free yourself from back pain. In this session, we're going to look at how to strengthen the core muscles, which are around the front, the sides, and the lower back. Now, if we make these muscles a lot stronger, the incidence of back pain and the severity of back pain will generally reduce. So these 4 exercises are key to helping you reduce back pain. Exercise number 1, forward ball roll. So we need a Swiss ball and a mat. So Tom's going to get into position now with his hands on the ball here, leaning forward slightly, then rolling the ball forwards. We want a slow, steady tempo, so 3 seconds forwards, a 1 second hold, and then 3 seconds back. Now what's important to know is the position of the spine. We want to have what's called a neutral spine, and the way that we check this is by placing a stick onto the back. We need the head, upper back and lower back all to be touching the pole, and we should be able to just about fit your hand in underneath there. So holding the stomach muscles in really tight. It also helps if you squeeze the glute muscles here. This tends to pull the pelvis underneath and holds it in the correct position. So we're looking for about 10 to 15 repetitions of 3 seconds out, 1 second hold and 3 seconds back in. So this is a great exercise for helping to provide some stability for the back through strengthening the core muscles at the front. Exercise number 2 in this series is called the horse stance. It's for core strength and lower back strength. So Tom's going to get into position now. So he's on all fours. We have a straight line from the knee to the hips, the hand to the shoulders, and again we can use our stick to place this on, so points 1, 2 and 3. So if you notice here there's a little bit too much gap, so Tom needs to suck his stomach in a little bit. That's it. So just enough to fit your finger under, and he's going to hold and maintain this position as he lifts his left arm up at about a 45-degree angle. Okay, Tom, lift your arm, thumb up to the ceiling, hold it for 5 seconds, then take it down, and then we're going to do the opposite arm. So holding the pole into position, just come a little wider, thumb up to the ceiling, holding for 5, good, and down. Now this time a little bit trickier, we're going to try and lift the leg. So Tom's going to lift his left leg, pushing the heel out and flexing the toes, so we're using the glute muscles here, whilst maintaining this position in the spine. So just pull in a little bit tighter, Tom, with the stomach muscles. That's good, holding it for 5 and then down. So we need to move slow, steady, in time with the breathing again. And the right leg, Tom. So we extend the leg out. We need to just tip the hips over just slightly there and draw the belly button in a little. So we've got just enough gap to fit your hand in underneath and down. So from this angle you can see how straight you have to be through the spine. So again, you place the pole onto Tom and get him to do single arm lift. Maintaining that position with the pole and down, and then the other arm. Good. Then the leg. Again, checking the pole to make sure. So you can get a friend to help you do this, just to make sure that pole's in the right position, especially to begin with, because it's difficult to know if you do this on your own, whether it's straight or not. Okay, now that looks good. Okay, so I'll just hold there. So a progression for this exercise. So after you can do this comfortably for 1 to 2 minutes, we need to be looking at increasing the difficulty of the exercise. So here, Tom's going to lift the left leg and the right arm at the same time, whilst maintaining the pole on the back and a neutral spine. Okay, Tom? So lifting the hands, that looks good here. Nice straight position. And down. So holding for 5 seconds again. Okay, checking the back position, which is good. Okay, thanks, Tom. So that's a progression for exercise number 2 in the series. For exercise 3 in the series, this is called the 4-point tummy tuck. So you're on your hands and knees again. Trusty pole. Place that on. So again, points 1, 2 and 3. Pole's nice and level, just bend down a little lower, Tom. That's it. So here, underneath, he's going to let his stomach relax. Just let it hang. We've got the position here for the spine. We can just about fit the hand underneath, so that's good. So that's a nice neutral spine that he has. Now he's going to suck his stomach up and in without changing the back position here. So squeeze in, Tom. So we're sucking the belly button in towards the spine, activating the lower abdominal muscles, or the transverse abdominis muscle. Holding it for 10 seconds and then relaxing for 5. So Tom, relax it down there. So he relaxes it and then lifts it up. Hold it for 10, 9, 8, 7. And then you can see that the spine is in the right position in relation to the pole. Just enough room to fit your fingers underneath. Okay, so that's exercise 3. That's 4 in the series, and the last one is breathing. Now, this might seem a bit obvious, but we do this every day. But how many of us actually do it right? Not very many. In my clinic, I would say 99% of people who come in, when we test their breathing, they have an inverted or incorrect breathing pattern, which can relate to a lot of tension in and around the rib cage, especially the lower back, upper neck and shoulder area. Now, when you consider that we take 28,000 breaths per day on average, if you're doing this wrong for most of those, you can see how it will lead to increased stress and tension in the muscular system. So to breathe properly is really important, and we're going to test this now with Tom, show you how to do this simple, easy home test. So Tom's going to place his left hand on his belly button, his right hand on his chest. Now he's going to take a deep breath in. Off you go, Tom. Now Tom's demonstrating here an inverted breathing pattern, so relax. Do it again. So watch his right hand will rise up before his left, which means we're breathing using the accessory respiratory muscles in the neck rather than breathing from the diaphragm, which causes stress and tension problems. So what should happen is we should be breathing in using the diaphragm, which means the stomach expands first and then the chest expands second. Now if you think about the breathing in 3 parts, so the first 2 parts come from the diaphragm and the last third comes from the chest. So the best time to do this is last thing at night before you go to bed, or when you're stuck in a traffic jam, you're sitting in the car, you can practice the breathing, getting that diaphragmatic breathing pattern to work. So we can do it in a lying position, which is the easiest, then in a standing position, and also in a sitting position as well. So you can practice this in the office while you're at work. Okay, so that's the series of 4 exercises for you. Enjoy those strengthening and toning exercises and see how much that reduces your lower back pain.